We published the first nursing textbook 133 years ago. Over a 130-year period, nothing changed much. For faculty and institutions, DocuCare solves the problem of how to integrate effectively technology into the curriculum.
DocuCare was born in the classroom. It was the child of committed educators with a vision for teaching and learning.
When I learned as an undergraduate, we opened a book, we read a bunch of chapters, we came to class, we regurgitated that on examination or verbally to our instructor.
Referencing printed materials and textbooks is exactly what we don't want to be doing. That's exactly what we don't want healthcare practitioners doing. It's not about memorizing what's in those books. It's about being very nimble, going from an electronic health record or a database or some other health technology to the evidence while you're actually working with a patient.
What you have here is the chicken and the egg situation. Students are not allowed to use documentation when they go to clinicals because of various privacy rules and so forth, yet they need to know how to do it the very first day.
The nurse students, on the first day of the work at the hospital, so they need to chart, they need to document the patient information. And imagine that they cannot do it. They have to do it for first, they have to learn from there. So I think that's not a good idea, from patient's perspective.
Our faculty members saw a need that was not available in the educational industry, and it was really around the fact that an academic health record or an electronic health record was not easily accessible by students.
So our students were not getting proper training that they needed to be able to practice in their future roles. So we needed to find something.
But nothing existed that mirrored the inpatient medical surgical setting in which we were educating our undergraduate students in.
We were looking at software product to train nursing students, and we couldn't find one, or not the one that we like anyway. So we decided to just go ahead and build one ourselves.
So we needed to find something. Couldn't find it, so we built it.
This product brought the passion of faculty members together with their skills. They brought in innovation and used collaboration to be very successful. And that's a great story.
So when we built our user interface, we said the heck with the back end right now. Let's build it for the nursing student so they can understand it, and it will reinforce those critical thinking skills that we spend so much time trying to instill in these people.
It's not about teaching students how to use an electronic health record. It's teaching them about how to think within it, how to think critically when they're working within an electronic health record system. And DocuCare is really the only thing out there that does that.
Now, they need everything else as well, obviously, the pathophysiology and the theory and those sorts of things, but you can tie that back and to have one piece of software solution to tie all that together, naturally, in my mind, is electronic health record. Again, bent for the educational use. So if you go into the system and you see a diagnosis that you don't recall, you can click on that and open up that content back in so you can learn on the fly. And I think it really reinforces critical thinking skills, which is something that in this day and age, you can't work harder. We just don't have the manpower. You have to work smarter.
It's the future of healthcare. It's the future of health informatics. DocuCare, tied to the clinical databases that work the way students want to work, serve up this clinically relevant evidence-based content at point of care. It improves healthcare and health outcomes for all of us.
We kind of look into how nursing used it on the floors, taking care of patients, and we just designed it from the front to the back. So I think that's one of the key success of DocuCare.
It's a learning tool. So not only are nurses learning how, the student nurses are learning how to document in electronic health records, but they're also learning how to use the data to inform their care.
We are bringing this technology to students that actually represents a workflow solution that improves health outcomes for individuals. Is a game changer. It's not merely a new approach to content management or a new way to access information. It's actually changing the way students think about how they're going to be doing their jobs and we're addressing the needs of 21st century learners.
So we built the front end to be very user-friendly, and then when we got into it and we started doing focus group research on that, what we found was the users didn't take any training. What they had is they went in, they opened the system up, and they went right to work. There was never a question on how do I log in, where do I go for this, that, and the other. So it validated the model very quickly for us.
I think really the magic was that we were educators building a product for educators. We relate well to students. Our students and students from across 3 different universities tested the products in the early stages.
Tammy set up this very nice open computer lab in the College of Nursing, and all the students plugged in. And they said, all right, raise your hand if you have any questions. 5 minutes, 10 minutes, 15 minutes elapsed, right? And no one raised a hand. So finally Tammy and Yo started bugging people, hey, are you having any problems? And the only problem was, leave me alone, I'm trying to work here.
It truly does reflect the needs of the users. And these records are now no longer just a snapshot in time like a case study has been in the past. The student can learn from previous visits, from previous days, from previous vital signs, and from previous assessments.
We're making this integration of technology into the curriculum and the content into the curriculum so seamless that they don't have to think about it.
They can gather data from the electronic health records that helps to inform not only the care of that individual patient, but care of patients in that particular population with similar disorders, with similar conditions.
DocuCare does bring the opportunity to hang all of the different pieces together in the educational cycle for the student and for the faculty. It bridges the classroom teaching, the clinical environment, the simulation lab.
DocuCare mirrors the real-world setting in that care revolves around the patient record.
It's a larger picture, and it helps to inform their decision-making for their future care.
There are over 4,000 nursing schools across the U.S. and Canada. An educational EHR for nursing, I think, is just a natural. I think all schools are going to move to it.
It helps prepare them to be better practitioners, to be able to hit the ground running post-licensure, and to be more effective employees for the hospitals that they're going to work for.
We're going to prepare nurses better for practice setting.
So it's really the only system of its kind on the market, and I think it is truly the first true educational EMR. It's solving a really big pain point in the marketplace.
We're really very, very optimistic for the potential that DocuCare brings to be a real lever in change and advancement of education for all healthcare providers and healthcare students.
I want to thank them that helped us take this product and improve nursing education throughout the nation and actually throughout the world.
So that's kind of where we came from, and those early focus groups said, you know what, you did all right with that. You did all right with that.